Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also connect with me on other social media platforms. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to speak about cardiovascular health and aerobic fitness. We're going to talk about a measurement called heart rate recovery. Oftentimes, heart rate recovery is abbreviated to HRR. Heart rate recovery is a measure of cardiovascular fitness, or aerobic fitness, and it's also a good predictor of cardiac death. So it's extremely important. This is something that's overlooked. You don't hear people talking about it too much. You don't see it written too much, but it is a very important number to help us in our training, to allow us to know if we are improving or if our health, especially our heart health, is just not where it should be. Now, this is a test where I recommend that you do it with either a medical professional observing you or with a friend who will know how to help you just to keep you safe. Now, this is a very important thing that I need to say. This is the disclaimer. Please, if you are doing the heart rate recovery test and you feel faint or you feel dizzy or you start feeling chest pain or something just doesn't feel right, please stop immediately and contact a medical professional. This is a test to measure your fitness. We don't want you to get sick. We don't want you to get injured or overdo it and strain yourself. Please, if you don't feel right while you're doing this test, please stop and call a medical professional. Always work with a medical professional. This test does not take the place of seeing a medical professional, and neither does viewing this video. Cardiac health, so important. We all know that. Take care of your heart, take care of your lungs, take care of your entire body. Get regular evaluations from a medical professional. This is a test where what we are measuring, heart rate recovery, is a measurement of your heart rate, your pulse, your beats per minute while you are exercising, and then 2 minutes after you are exercising. So it tells us how your heart recovers following exercise, following exertion. So this is extremely important. It's going to be a very good measurement to tell us about your aerobic fitness and also about a risk of cardiac death. So what we want to do is you want to exercise doing some type of cardiovascular exercise. Could be a recumbent bike, could be a treadmill, could be walking, really whatever works best for you. And I always recommend that you pick something that you could do on a repeated basis, because you may want to repeat this test every few months, say like once a quarter or once every 6 months, to check on your progress. So if you have a recumbent bike, just as an example, if you have that handy, then go ahead and use that. Or if you have a treadmill, go ahead and use that. Really whatever you feel most comfortable with and whatever is available to you on a regular basis. So you want to start exercising, and just like any other type of exercise, you want to start slow and you want to build up. You want to take your pulse while you are exercising, and you want to get inside your target heart rate. Now, if you saw my last video on target heart rate, you know how to determine what your target heart rate is for your age. To determine your heart rate recovery, you have to know what your target heart rate is. So when you start exercising, you take your pulse in regular intervals. And once you reach your target heart rate, that's when you want to go ahead and stop. Now, target heart rate is 50% to 80% of your maximum heart rate. And your maximum heart rate is determined by subtracting your age from the number 220. So what I always tell people, obviously you need to have this figured out ahead of time, what your target heart rate is. And what I always like to tell people is when you are doing your heart rate recovery, you don't want to go crazy and overexert yourself. So what I always recommend is go to about 70% because it is in that 50 to 80 percentile range. So go to 70%, and once you get your heartbeat to 70% of your maximum heart rate, you want to go ahead and stop. And you sit down or you lay down, you just get in a comfortable position. If you want to walk, you can, but I recommend that you sit down or you lay down and you wait 2 minutes, which is 120 seconds. Obviously, 120 seconds. The reason I say that because the first number that we took was our target heart rate, so we abbreviate that to THR. Our second number is HR120. So that's why I said about the 120 seconds. So once you reach 120 seconds, you take your pulse again. So we have the first number, which is the target heart rate, and we have the second number, which is our heart rate at 120 seconds after we have finished exercising. And you subtract that number. That number is your heart rate recovery number. Now this number is extremely important. The higher that number is, the greater your cardiac health, because your heart is recovering after you've finished exerting yourself. So this is a test that measures your heart's ability to recover after you have exerted yourself. So we take the target heart rate, and from that number we subtract your heart rate at 120 seconds, and that gives us your heart rate recovery. And like I said, the higher the number, the better. The higher the number, the higher your aerobic fitness, because your heart can recover better. If you scored 25 or greater, meaning that your heart recovered 25 beats or more within those 2 minutes, that means your aerobic fitness is strong and you have a lower risk for cardiac death, minimal risk for cardiac death. If your score is between 15 and 24, it means you have a lower than average risk of cardiac death. If your score is between 13 and 15, you have a moderate risk of cardiac death, and it is highly, highly recommended that you see a cardiac specialist or a medical professional and get your heart checked. If you are 12 or lower, you need to immediately contact a medical professional and get the proper cardiac evaluation. So this is a very important test. It is a measurement of cardiovascular fitness, and it is also a measurement of your heart health. It is always recommended that you work with a medical professional when you are dealing with issues for your heart. So please, if you fall into one of the risk categories, please contact a medical professional and get the appropriate evaluation. When you are doing this test, if you do one test now and then another test next quarter and then again next quarter, you always want to try to keep the testing consistent by doing the same type of exercise and resting for the 2 minutes the same way and taking your pulse the identical way. If you can do that, it's going to help you a great deal to get more accurate measurements, so you will be able to evaluate your progress. Heart rate recovery can be improved. Heart rate recovery can be improved. Your fitness can be improved. The health of your heart and your lungs and your musculoskeletal system can be improved. This is something that I love to speak about. I always let people know, please find an exercise that you enjoy. Do it correctly, do it consistently, get adequate rest between training sessions, and make the best food choices. Again, your heart rate recovery can be improved. Consistent exercise, adequate rest between training sessions, and proper nutrition. Contact a fitness professional, contact a nutrition professional, contact a doctor of chiropractic like myself. We will be able to help you to increase your health and increase your fitness. Please do everything that you can to improve your heart rate recovery. Find nutritional and supplementation strategies that work for you. Keep a dietary journal. Write down everything that you eat. This will help you to see how you feel after you eat. Keep details on what you ate, how you felt, how your workouts felt. Were you sleepy? Were you energetic? All this information is extremely valuable to you. Keep this journal. Write down everything that you can. Use the information as feedback to help you to formulate dietary and supplementation strategies that work for you. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I spoke about heart rate recovery. Please feel free to leave any questions, suggestions, or feedback in the comment section below. If you want to contact me, again, leave it in the comment section or send me a message, and I will get back to you or reply to your message as soon as I possibly can. Please feel free to visit my website where you can get additional information on my book and also connect with me on other social media platforms. Also, if you like this video, please give me a thumbs up. I appreciate you viewing this video. Thank you very much. My name is Donald Ozello. I'm a doctor of chiropractic at Championship Chiropractic in Las Vegas, Nevada. Always remember, train hard, train smart, stay injury-free, and accomplish your goals.